Welcome to Heart-Based Medicine's Behind the Mask. Featuring Dr Sarah Goulding, Portfolio GP from the NHS, Head of Coaching and the Joyful Doctor. What coping strategies to avoid burnout for doctors can you share with us?
Number one, during the pandemic, it's reducing your expectations on yourself and really prioritising self-care, knowing that it isn't selfish, knowing that you need to put your own oxygen mask on first before you can help other people, and that you can't pour from an empty cup. You know, if you're in the caring profession, one of the first signs is that you stop caring, that you run out of energy. So it's looking to ways to how you can fill your own cup up first. And whatever that may look like, you might need to drastically reduce your expectations of yourself. Buy in food, cancel extra Zoom meetings that you don't need to have. Make sure that you get out into nature. Mindfulness is very powerful and evidence-based. And finding an app or a form of meditation that works for you. There are lots of different resources online. And just allowing gaps in your timetable to do nothing. And you don't have to feel guilty about that actually you need that time, even if it's just 2 minutes, sitting still, doing nothing, to allow yourself to just let that adrenaline drop. Even when I talk about it, I can feel my voice drop, my shoulders drop. I'm taking a deeper breath. It's finding what works for you and acknowledging that we're all going through lots of difficult emotions at the moment, and that can change what feels like from minute to minute. There is nobody winning in the current situation. So however you are feeling is okay, and that you're not alone, and that if it does get bad, to seek help. Certainly not perfect at it. And I think having gone through it all, you learn your lessons and then you look out for it more. And I think you can get those things, you see warning signs, right, I need to put these plans in earlier, get out into nature. Even just having a plant pot on your desk has been shown to improve your well-being, and doing things like gratitudes as well and journaling. There's lots of good evidence behind this stuff. So it's not indulgent. Yeah.
What are the warning signs, the early indicators for burnout?
The warning signs, the three big things about burnout that the World Health Organization categorized as from chronic workplace stress, basically related to depletion in resources, and that's either mental, physical or emotional. So physical, you might find that you're not refreshed after a weekend off, after a week off, an evening off, you're still feeling exhausted, or even if you've had loads of sleep, you become less efficient. So things that were previously you'd be able to get through quite quickly, like I found when I was trying to file my blood results. And there was something really easy that normally I'd have gone, okay, it's that, do this. I was sitting there and it was like thinking through treacle. I just couldn't get there in the speed. So slowing down of thought processes or making errors. And the other one is kind of compassion fatigue, difficulty in getting interested or as excited in things. And in the caring professions, we're talking about work, but it's also in yourself. So it might have been that there are things that you normally would have looked forward to at the weekend or in home time, or a favourite TV programme that you lose interest in. And I think if you start noticing those in yourself or in other people, it's time to really take stock and just kind of look at things in a broader sense, and not try to diagnose yourself, because we're terrible at trying to diagnose ourselves. I had no idea what was going on with me. I thought I was probably a bit stressed, probably a bit of anxiety. And when this lovely counsellor said to me, yeah, well, burnout's really common around medics, I went, what, you think I've got burnout? And because I'd been working part-time, I didn't think I was eligible for it. Looking back, that's a bit bonkers now, but yeah, it's letting other people help you work out what's going on and how to help get better from that. And sometimes that might mean time off. And other times you can do more of the smaller tweaks, and that helps too.
How did your burnout impact on your relationships and your family?
I did not have as much bounce back ability when I had burnout. I wasn't fun mummy. My sense of humour, and normally I love a laugh. I'm quite silly. I quite like a physical play. I'll jump on the trampoline with the kids. I'm normally seen as a bundle of energy running around the place. That went. It was, I didn't have the ability to think about what I was going to cook for dinner, or even whether I could be bothered to make dinner for people. So I think I was probably snappier. I was more serious. And I think a lot more of the responsibility of household chores fell to my husband. He's very good at doing lots of them anyway, but he definitely needed to take on more of the meal planning, of the looking after our children. I think that fell to him more. And I suspect, I don't know if my children would have noticed, actually, because they were relatively young at the time. But I remember just not wanting to engage as much and kind of being quite insular, certainly at the beginning stages of it. And I found that it was very fluctuant. So it might have been one day I had loads of energy and the next day I was just wiped out. So I think that's probably how it was, but it's hard really to know now how it was looking back. Medics are only just now really recognising it as a proper condition, in inverted commas. I think unless it was anxiety, depression, one of the, acute stress, people didn't really recognise it as a thing. Whereas now I think one of the advantages of the pandemic is that people really are paying attention to healthcare workers and their mental health right now, because it's so under pressure that actually it's getting more attention than it ever has done. And that may be one of the lasting positives, I hope, is that we start building that in at all sorts of stages.
Does burnout present differently for different people?
Yeah, I think people do get different things that are predominant. I think some people experience it as sort of extreme stress and not being able to cope. Some have this complete apathy and lethargy, and so I think that's where it took me seeing somebody else to piece it all together, actually, is because I think it does have these overlaps with anxiety and depression and stress. And certainly the people that I coach, mostly they've recognised that mental health side of thing, and they're trying to work out how to create a career that is more protective to them, or more fulfilling, or less draining. And so I'm often seeing them at the point where they've sort of moved beyond that. They've looked after themselves, and then they're like, okay, now what? How do I move forward? And people have very different stories as to how it affected them, which is interesting.
What is the negative impact of physician burnout on the medical system as a whole?
I think burnout is a huge issue for the medical profession. I think its prime thing is that it's losing good people from incredibly well-trained, compassionate professionals who just can't carry on anymore because the work is breaking them. And that was happening before this. And I think certainly as part of the NHS, when money hasn't been put into the system and people are being given more and more work, and professionals are having to just take the hit, they're the ones that end up being battered and bruised and leaving. There's a big spike in losing women to the NHS around their late 30s. And my perception of that, and that's not really been looked into, my perception of that is that it's people like me who have children at school age who find that their working life isn't compatible with also being a mother. When children are younger, they can go into nurseries. Those are longer days. If you're working 12, 14-hour days, how can you have childcare? And particularly if you've got somebody else who's working in the family, it makes it almost impossible to do that while also fulfilling other really important roles in your life. In terms of other, you mentioned disasters in terms of the medical profession. I think the big disaster is losing staff. It's recruitment and retention. And we've seen from high profile news cases where if you make an error, it's not the system necessarily that will get the blame for it, it's you. And so how those people are looked after in a situation where they're put in situations of extreme stress and pressure. And certainly that's happening, of course, now, but it was happening before as well. The deadlines, the targets we had to meet, certainly in general practice, the amount of appointments that GPs were expected to provide with less money, and so fewer doctors and nurses. Of course, those are numbers that aren't going to match. And the thing that gets lost is continuity of care, quality of care, satisfaction in your job, and ultimately people leaving or feeling unable to do as many sessions as they might have done before. For all of those reasons, there's so much more medical complexity now that the setup often isn't fit for purpose.
Does burnout for medical health professionals impact negatively on patient safety?
Certainly when I trained, people were reliably going home at 6 o'clock or 6:30 as a GP and maybe being able to go home for lunch. I can't think of a single time any of my colleagues were able to do that when I was a partner, and it's become the norm that you eat at your desk. And yeah, if you're not a refreshed member of staff, how are you going to stay mentally sharp? And also it's a very, what's the word? We're very protective. We're very nervous about being sued. So we're practicing very defensively, which isn't necessarily the best way to be, because you can cause harm by over-investigating as well, or by over-treating, over-medicalising the elderly. I'm worried that if I don't give them something for their high cholesterol and they have a heart attack, they'll sue me, even though they're on 15 other drugs and this might give them side effects. It's become a very difficult way to practice, with all the extra expectations and the hoop jumping of regulations to jump through.
What message do you have for medical institutions?
I think rather than speaking to hospital management, I would speak to the policymakers and the people funding it. It needs a huge injection of cash, because without a doubt, the less money there is in a system, the less able it is to provide to the needs of an ageing society. I think people are making incredibly complex decisions, and actually we've got a lot to be proud of in terms of how the medical establishments have flexed and responded to the pandemic. They are remarkable institutions, and all the general practices, they have wholesale changed how they're providing care. That's remarkable. Try to keep the good stuff, keep the good people, listen to their ideas, and try to reduce the bureaucracy that's holding people back, and allow clinicians a say in how they run the system, with advice on efficiency. But really, for me, it's about a whole load more money needs to go in.
This has been a Heart-Based Medicine production. Thanks for listening.